Hello guys, the topic that we're going to talk about is the Tofacitinibid induction and maintenance therapy for ulcerative colitis. My name is Cristian Rosso Borja. I'm studying at Universidad Católica Santiago in Foresight Medicine. There are my social networks, so follow me and let's watch the definition. Definition is an oral small molecule Janus kinase inhibitor was shown to have potential effects as induction therapy for ulcerative colitis in phase 2 trial. Ulcerative colitis is a disease that causes inflammation and sores like ulcers in the lining of large intestine. It usually affects to the lower section, like small colon and the rectum. How do you can infect entire colon? Let's watch it.
Inflammatory bowel disease can cause inflammation in the small and large intestine. In other words, inflammation of the bowel. Colitis refers specifically to inflammation in the colon, or the large intestine. Ulcerative colitis is a type of inflammatory bowel disease that tends to form ulcers along the inner surface, or lumen, of the large intestine, including both the colon and the rectum. These ulcers are spots in the mucosa where the tissue has eroded away and left behind open sores or breaks in the membrane. Sometimes there's a flare, which means that new damage has occurred, and then there are periods of remission when the tissue starts to heal up. Ulcerative colitis is actually the most common type of inflammatory bowel disease. Not that there are that many, but this one causes inflammation and ulcers in the mucosa and submucosa of the large intestine only, which is an important point that sets it apart from Crohn's disease.
Interesting details, so let's continue. Application terminal. Tofacitinibid. Applications in medicine. Tofacitinibid currently inhibits cytokines that signature JAK1 and JAK3 or both, include pro-inflammatory cytokines and some interleukin-5 that may be beneficial in the treatment of inflammatory bowel disease. However, the clinical safety efficacy observed in the TED trial showed that the overall effects of treatment were beneficial.
Detailed results from the Phase 3 oral clinical trials of tofacitinib in ulcerative colitis, or the OCTAVE clinical program, were recently published in the New England Journal of Medicine. The publication of detailed results from the OCTAVE clinical development program in the New England Journal of Medicine included data from two identical Phase 3 induction studies, OCTAVE Induction 1 and OCTAVE Induction 2, and one Phase 3 maintenance study, OCTAVE Sustain.
Pros and cons. Pros, we have 2 points. First point, patients with active ulcerative colitis will fail prior treatment and achieve significantly greater remission of disease and the mucosa healing compared to those treated with placebo. And second, remission of ulcerative colitis symptoms over 1 year was significantly greater for patients who initially response to tofacitinib and continue therapy continued compared to patients of response and then were treated with a placebo. Cons, the side effects like blood pain, poor urine, poor vision, patterns of pain, fever, frequent urge to urinate, and headache. These can affect the immune system of the body, making it lower. more things about ulcerative colitis and what we can do. That way that could be charged and flexible.
5 worst things about colitis. And these aren't in any order, by the way. Number 1. Finding the nearest toilet. This one really does suck. You must always be on the lookout for toilets when going out of the house, whether it be public toilets or shopping malls. You have to be on your game. Number 2 and 3, having 3, 4, 5, 6 bowel movements a day, getting fed up of rushing to the toilet, and also thinking that, you're doing fine, and then suddenly you get another relapse. That really does suck. Number 4, having to take medication for life. You know you have to take it because the doctors have said so, otherwise you might die of your body attacking itself. Number 5, trying to explain to someone what colitis is, because it's quite embarrassing when you talk about your number 2s. It's always hard to explain to someone why you're going to the toilet so often, and that also has its drawbacks. But guess what? You don't need to have any of these problems. Colitis is a disease of the body that need not occur. The reason a lot of people get colitis is because of a poor, unhealthy lifestyle and poor dietary choices. Eating lots of inflammatory foods such as processed meats, meat, dairy, eggs can cause the bowel or colon to overload with toxic fecal matter, which saturates.
Let's stop and continue. Application in color. Tofacitinibid is used alone or with other medication by medical techniques to treat moderate to severe forms of rheumatoid arthritis. It helps to decrease pain, enlargement, and swelling results. Use a bit.
Ulcerative colitis, predominantly just in the colon, starts in the rectum and then works its way around. What does that look like when you do colonoscopy? What's the biopsy look like?
If you do an examination with the colonoscopy, what you'll typically see is redness in the colon. It'll almost have a purplish do an examination with the colonoscopy, what you'll typically see is redness in the colon. It'll almost have a purplish hue to it, and it'll look diffusely inflamed. So the entire colon from start to finish hue to it, and it'll look diffusely inflamed. So the entire colon from start to finish hue to it.
Excuse me, the internet is failing, sorry.
And it'll look.
We are slow.
Its way around. What does that look like when you do colonoscopy? What's the biopsy look like?
If you do an examination with the colonoscopy, what you'll typically see is redness in the colon. It'll almost have a purplish hue to it, and it'll look diffusely inflamed. So the entire colon from start to finish.
Let's continue. It's not charging, so excuse me. We pass the lane. So, in conclusion, in patients with moderately to severely active ulcerative colitis, tofacitinibid was more effective as an induction and maintains therapeutic than placebo. So, endoscopy video of how it looks in the colon. So beautiful. Let's watch. I think that the Wi-Fi is not helping me, so sorry about that. YouTube you can find this. See,
While Crohn's disease is often characterized by a discontinuous inflammation with longitudinal ulcers, ulcerative colitis represents mostly as a continuous inflammation starting in the rectum. This patient presents with severe bloody diarrhea. Endoscopy reveals continuous mucosal inflammation starting in the rectum and mucopus ulcerations and spontaneous bleeding representative of a Mayo ulcerative colitis score of 3. Histological
look, it's so white. It's so cool white on the ulcer. Look at that. It's so beautiful.
analysis confirmed diagnosis of ulcerative colitis,
Can
and the
cause-
patient was put
can cause diarrhea, always mucosis a lot.
on immunomodulating therapy, which resulted in a rapid improvement in symptoms. This case demonstrated a Mayo ulcerative endoscopic score of 2. In comparison to Crohn's disease, ulcers in ulcerative colitis are more superficial and confluent. Moreover, one can visualize some frank friability, erythema, and absent vascular pattern. Surveillance in the area of acute inflammation is often unsatisfactory and should be repeated after an adequate immunosuppressive therapy.
So that's all. Thanks for watching the video. Let's see in a little time. I would like this helps reduce our